Good evening, everyone. I hope you are doing well. Today, after 2 weeks, we are meeting again for Did You Know Season 2, Episode 7. And today it will be just a mix of diseases that are related with one specific emotion. I am just trying to help you to look at the disease in another perspective. For sure, this is based on each person and it's personalized. And the fact is that it's only to have an overview about the disease and thinking outside the box. So this is not the only fact that is psychosomatic. There are multifactorial meaning of a disease, but now we are focusing on the psychosomatic and the meaning of these different diseases that I'm going to tell you about is related to an emotional rigidity, being rigide emotionnellement, being steif auf Deutsch. This is emotional rigid. It means we are not managing our emotions. We are not dealing with our angriness. We are not dealing with our frustration. And these symptoms or these diseases that we will see together are all of them related to a pressure that is inside us and is not worked or looked up, and just to understand and put some consciousness about this pressure. For example, high blood pressure. It's like the name it says. We have a high pressure in us, like a cocotte minute. And from where is coming this high pressure? What are we doing with our angriness? We are pushing it down. We are not dealing with it. Yes, true, we can go to do sports. Yes, true, we can go and express with yoga, with football. We can just work our emotions with activities like sports, like meditation. This is completely true and this is completely possible. However, the most of us, what we are doing is we are doing sports, getting out this angriness out, but the angriness is still there. Whenever we are facing another situation that is similar to something, a blockages that we have, it will no longer be the same. So sport will support us on the time being. But if we don't really deeply work on an emotion, on what our body is trying to tell us, like the high blood pressure, for example, this will go even worse with time, because at one point we will have a breakdown. So another disease that could be also related with a rigid, emotional rigid, it's the musculoskeletal disease. When we have a contraction, a muscle contraction, for example, or we have a back pain, or we have shoulder pain. So this is something as well our body is saying, what are we doing with our emotions? Why don't we want to manage our frustration? Why don't we want to learn how to let go? Letting go is not that I don't want to feel it, I push it down and just it's gone. No, letting go is really learning to see, to accept the emotion, to see the blockages and work on our different parts. And especially work on the fact that we are expecting and waiting and expecting something from the other, from ourselves. And this muscular pain, or if we have muscular inflammation, this is also a sign to show us what we have as a blockage inside us. Another disease, which is arthritis. Arthritis is a joint problem. For example, our knee, we cannot go forward. And what happened is that we are blocked and we stand up. And if we want to try to walk a little bit, we want to go forward in life, we are just blocked. Blocked with the knee, blocked with the hip. So this is as well is rigid. Our knee is very rigid. So what happens then, if what we want to do with it is how to deal with these emotions in this regard. Another disease, what could be also interesting, is that asthma or respiratory problems is also related to how are we dealing with emotional stress. we cannot breathe, what is blocking us, what is our sinus trying to tell us. Another disease as well is cardiovascular disease, heart issues, internal pressure. How are we going to deal with our internal pressure? So all these diseases which related to inner pressure, high pressure, low pressure, inner pressure, it's a lot of pressure inside. And this pressure is coming from an emotional rigidity, which means that we don't want to manage our emotions. We just hide it or block it, or we just pretend to remain on a superficial layer, and then we don't want to go forward with it. Oh, that's fine. I have the positive philosophy. I have a positive thinking. Yeah, that's okay. But the fact is that positive thinking like this is a little bit superficial. The aim is we need really to put understanding in order to know and understand this blockage and this rigidity that is in all of us. As another sign as well, if you have bruxism, if you have as well teeth issues, this is as well an angriness that is not worked. And here could be really interesting to go and check our angriness, or for example, we don't want to get angry, we want to be the nice kid. Why? What happened? So all these parameters, all these symbols, all these what our body is trying to tell us, these are really signs where we have to look at. So I hope that I could help you a little bit what means emotional rigidity and how emotional rigidity could be linked with different diseases, and how we are thinking outside the box. I really enjoyed this episode with you, and we see each other in 2 weeks. I wish you all a nice evening and a very nice weekend. Bye bye, everyone.